So good afternoon, everyone, and welcome to the second Q&A clinic on XEVMPD service for this year. My name is Katerina Scarpati, and I'm supporting the change management activities for XEVMPD and SPOR services. And today with me, I have Veronica Baker and Veronica Lipucci Paola, who will be here to answer any questions you may have on this service. Before we start, as usual, some housekeeping notes. So first of all, please note that this session is being recorded and it will be made available through the EMA corporate website event page and via EMA YouTube channel. You will be able to ask your questions or give your input via the audience interaction tool Slido. Please note that the interaction via Slido is voluntary and you may opt to remain anonymous. If you choose to use Slido, remember you consent to the processing of your personal data as explained in the dedicated EMA data protection notice. So, as said, you will be able to ask your questions via Slido. To join this specific session on Slido, you can just go to slido.com, inserting the code XEVMPD 1202, or just scanning the QR code that you see in this slide. Once in Slido, you can type your questions and send it, or just have a look to the questions that are already available there and upvote via the like button the questions that you would like to hear answered. And we will answer the questions in order of upvote, so the ones with the most upvotes will get answered first, and we will answer live, showing questions on the screen. And just also a reminder of the scope of this Q&A clinic. So we will answer here live questions regarding the XEVMPD service, while for questions related to other sports services, so SMS, OMS, RMS, or PMS, other live dedicated Q&A sessions are organized monthly by EMA. And here you can see a recap of the next Q&A clinics for each of these services. The registration link is already available for all these clinics on EMA website on dedicated event pages. And please note that starting from last month, for SOR and XEVMPD clinics, we are making the Slido links available earlier, so you can already find it on the event pages. For the March ones, they will be loaded really soon, I think tomorrow or maximum on Monday. So in case today you don't manage to ask the question you would like to, or in the next few weeks, you already think about a question that you would like to get answered in the next clinic, you can just go to the event page and join Slido by the provided link and include your question there. So we will already find it when we start with clinic next month. Here, there's also a recap of upcoming webinars. So as you may be aware, we have quarterly SPOR and XEVMPD status update webinar. We had the last one on the 28th of January. In case you missed it, I invite you to check out both the presentation and recording on the event page on EMA website. While the next ones for the whole year are already scheduled and the registration to the WebEx sessions are already available on the dedicated event pages on EMA website. And just a last reminder before we start. So I remind you that the SPOR and XEVMPD customer satisfaction survey is available. It has been available since the 8th October. And it will stay open until the 8th of March on Slido. So I invite you to go there to leave any feedback you may have on your experience with SPOR and XEVMPD services. You can either find it via slido.com, including the code SPOR-survey, or you can just scan the QR code that you find on this slide. But now let's start with our Q&A. So first question, when the training session for the new XEVMPD interface are planned to take place. So Veronica, I leave this to you. There are, yes. To my knowledge, I know that there are no planned training sessions for the XEVMPD new interface, but please feel free to complement.
That is correct. There is no need to have dedicated training or retraining. However, with regards to the XEVMPD e-learning training of new users, you can already request this kind of training and the knowledge evaluation to be performed in the new user interface. If you have a look at the XEVMPD training webpage, you will see that the updates of the content were already made to reference the new user interface. In terms of the DIA training, so the virtual training organized by the training organizer DIA, the first training that will be taking place in the new XEVMPD user interface will take place on the 11th of March. Thank you.
Thank you, Veronica. Next one. If in section 2 of SMPC, exact volume of activities is unknown, for example, 200 milligrams is mentioned, however, volume is unknown, what value should we consider in a denominator? Should it be 200 milligrams -1 or some other approach need to be followed?
Would you be able to provide information related to what is the pharmaceutical product form? You know, the active substance is present in something. It's either in a tablet or in solution, or any other type of pharmaceutical form. So this is what how it should be expressed. Can you provide maybe an exact or additional information? That would be great. Thank you.
Okay, I leave this question open. Okay, so to anyone who has asked this question, please, you can just comment on the question, and then I'll resume the question once you have included this information. Okay. Next one. Could you clarify if indication on PT level will be mandatory and from when? Please note that this is changing lots of MAH's internal processes, and also data will not be harmonized, as we have 900 products with LLT level.
So this is not mandatory. It was our recommendation. You can, as MAH, you can provide either LLT terms or PT terms in your product. We are not making it mandatory. It is up to you to decide what works better for you, whether you will provide one or the other, or indeed combination of both. There is no need for you to update medicinal products with a dedicated update. I.e. you don't have to go and perform an update of your 900 products to change LLT terms to PT terms. You can perform an update as and when it's required, for example, following a regulatory procedure. And if you choose to include the PT term in that product entry during that update, you can also include the PT term. Okay, but it is not mandatory.
Okay. Thank you. In PMS, date of first authorization and authorization status date present, however, in XEVMPD, we are submitting latest available date, and in SMPC SCN9, we do not have both dates. What approach should we follow as first authorization date in PMS is blank?
Maybe Veronica can take this question, colleagues. Hello. So I assume that the date of first authorization element in PMS is blank because your product is a CAP, is a centrally authorized product. In this case, as per chapter 7 of the EU implementation guide, the data element 3.6 is filled via SciAmed database, but SciAmed, as you know, contains only centrally authorized products data because it's our EMA database, and the date of first authorization for the non-CAPS products is not populated. So I assume your product is a non-CAP. Maybe you can enter your comment, maybe, so I can have a look even in the name. Thank you.
Okay. So I keep it open. Next one. Okay, so this is just, not just, it's really nice. It's an appreciation comment. Just wanted to say thanks for the implementation of a new UI. Works already really nice and helps without the need of ActiveX and IE tab. So that's great to hear.
Thank you very
Thank
much.
you.
Thank you. This is really nice to hear.
Yeah. Okay, then next question. To comply with the required submission timelines, would it be acceptable to calculate 15 or 30 calendar day period from the date on which the PHB division received this relevant information from the company's regulatory affairs division?
So our guidance is that it should be the 15 to 30 calendar days of the decision being received by the marketing authorization holder. We do not really specify which particular department within the MAH organization. And it's really hard for us to kind of tell you where exactly this decision should be received, rightfully received, and from that day when the 15 or 30 calendar day period should start. So I think this is something that you kind of need to decide on within your organization.
Okay. Thank you. Then there are a couple of people who are unable to perform invalidation in the new user interface.
So if this is the case, then I would invite you to please open a report of an incident, so a technical issue in the new user interface through the service desk, and provide all the required information, so full screen screenshots, so we can see how you're actually logged on to the new user interface. Also the product EB codes that you're attempting to invalidate, etc., etc. During the UAT, we had no issues with this particular operation. Obviously, as you know, what can be performed, or the operation types that can be performed for the product entities, depend on the ownership of the entity. So are you logged onto the user interface under the ID of the organization that actually owns the product entity? Is the entity already invalidated? Is it already nullified? These are all the checks that we need to take into consideration to see if the invalidation should be allowed to be performed, or if there's any other reason why the system is not letting you to perform the invalidation. So if you can, please open the tickets, and we will try and get back to you as soon as possible. Thank you.
Thank you. Vigilance human, disabling HTTP schemas as per email of 9th of February. Could you please give more background and inform about what exactly will be changed? So what are the future URLs for the schema?
So this is related to ICSR submission, not XEV appearance submission, so I cannot really advise. What I wanted to say is this change will not affect XEV PRM submissions. So the HTTP schema changes for vigilance, i.e. ICSR submissions, but not for medicinal product report submissions. I would invite you again to maybe open a question through the service desk directed to the vigilance team with regards to getting more information related to this. Thank you.
Okay, thank you. Okay. First authorization date in PMS is blank for non-CAP products. What approach need to be followed to get it updated?
Okay, thank you, because that was the indeed the information I was looking for. So as I said, in chapter 7, non-CAPS products first authorization date is blank indeed, because we don't have this information loaded into PMS. You don't need to do anything. What you should be seeing anyway, either in API or in PUI, depends where you are, you access it. You should be seeing the date in the authorization status date area at least, because this is the value that is coming from XEVMPD. But the first authorization date, we don't take it from XEVMPD. The only way in the future, but this is again not foreseen for 26, at least not yet, is to once we will be launching the full ad capability and enrichment capability of the whole PMS datasets, then you can implement and add all the missing information, including this one. But for the moment, maybe please have a look. If you in PUI or an API, you can see at least the authorization status date. If not, then we need an incident ticket type so we can investigate and let the data propagate correctly. I need to see in the backend what's going on. Thank you.
Thank you. Next one. So regarding preferred terms, on one slide in the status update webinar on what's next, what will be done in Q1 2026, it was mentioned that PTs to be entered for new products or during the next product info update. Does this mean new products need PTs instead of LLTs?
Again, it is recommended. So if you are a company that wish to include the PTs in your product and you have new product submissions to be made because your products were newly authorized, then you should go and enter the product information with the PTs during your initial submission. If you are updating a product and if you wish to include the PTs instead of LLTs, you can either remove the LLTs and enter the PTs, or you can add the PTs to the already existing LLTs.
Okay. Thank you. Next. So is the cleansing in the SMS list, so double entries, zero flag, already adapted in XEVMPD?
My understanding is that SMS colleagues have performed some cleansing already. With regard to the SVG flag 0, I'm not entirely sure if this has not been postponed. So I recommend maybe checking with the SMS team through a dedicated ticket or during the SPOR webinar, SPOR clinic with SMS colleagues. I believe that we missed that though. That was beginning of this week, right?
Yeah, it was on the 10th. Next one is 10th of March.
Okay.
Yeah. Thank you. Then next one. Authorization renewal date. We had two marketing authorizations where the date was changed by Article 57 validation group from latest renewal date to initial marketing authorization date. This contradicts the respective guides. How should we proceed?
If that's the case, then please open a ticket and request information why this was changed. If we have made a mistake during the validation, we will update the product so it references the correct date. If we have not made a mistake, we will provide you with the rationale why this was changed.
Thank you. Next, with a new user interface, just wanted to ask about the newer acknowledgement in the inbox. I can only see those from 2019 and 2020.
So if I understand correctly, there are no acknowledgements past 2020, right? In that case, it seems, and I presume again that your organization has obviously submitted inserts or updates or invalidations or any kind of maintenance related operations for your product after 2020. I would recommend again, please send us a ticket, report it as a technical issue, so through the incident form, so our colleagues can investigate. And again, please include all the possible details, example of an acknowledgement that you would expect to see there, or at least give us a product EV code which was updated recently and for which you did not receive the acknowledgement, and we will investigate. Thanks.
Thank you. Next, due to an MAH transfer, we have invalidated 12 records in XEVMPD. On the next day, there was still one record visible for us in PMS and not for the new MAH. Why did one record not work exactly like the other ones? Can you solve this, please?
I'm reading, sorry, 12 record next VMPD. On the next day, there was a still. Okay, so I don't know if you have opened an incident ticket, but it might be due that in the MAH transfer, I don't know if you had the chance to follow our spore status update webinar. I gave a presentation on some bug fixing and data fixes that we are running over Q1 exactly for the packages not visible. And we are gradually addressing all these issues on the impacted products. So I don't know if this is one of your products in the list that we have. If not, you can anyways create a ticket as an incident type, and I can have a look. Usually, I noticed that if it's an MAH transfer, there might be the invalidated records in XEVMPD might still be in the pending status version. So maybe you can have a look in XEVMPD or share with me the EV codes. And if they are in pending status, I can ask the XEVMPD team, so actually Veronica Baker's team, to validate the records that you have invalidated, so make it okay. And the data should be reflected correctly. But I will need a ticket ID at least to have the PRD codes. Thank you.
Okay, thank you. Next. How should we register products prepared in a hospital per a magistral formula pharmaceutical prescription? Do we need to enter compendial but non-authorized products? For example, GMPs administered together with non-marketed compendial products.
So if the product is not authorized, then it is not subject to the Article 57.2 legal requirements. So you don't have to provide information about this particular product or type of product in the XEVMPD as per Article 57.2 legal requirements. However, if this product is used as part of a clinical trial, then you would have to insert the product information for that unauthorized medicinal product in the XEVMPD as a DMP indeed, so development medicinal product.
Okay, thank you. With a new XEVMPD interface in place, would the old interface be decommissioned or both shall exist simultaneously? And the MAH can choose which interface to carry out submission from.
That is correct. So we have a transition period of 3 months since the go live. So the go live was in the evening of the 10th of February, which means that until the 10th of May, you can use either or both of the user interfaces to perform your submissions. From 11th of May, the access to you as external users will be restricted and you will have to use only the new user interface. If you are already an existing XEVMPD user, you should have received a communication email which makes a reference to a knowledge base article in the service desk which contains this information. So I would strongly recommend maybe have a quick look at the email if you have received it, and have a look at that article which also explains the next steps with regards to both of the user interfaces, etc. But we will still have both user interfaces which work and will work simultaneously until the 10th of May.
Thank you. Okay, next. The volume of active substance is unknown, mainly includes tablets, powder for solution, for injection, etc. This is general question which can be applicable for all kind of dosage forms, as some of our products don't have volume in section 2.
Okay, so in that case, you would have to combine the information which is in section 2 and section 3 of the SMPC. So section 2 says, the 200 milligrams of the active substance, and section 3, I believe, will tell you that the pharmaceutical form is, a tablet, or if it's solution for injection. And in that case, you will then combine these two to enter the volume of the active substance as per that particular unit of measurement or unit of presentation in the XEVMPD product entry. So if it's a tablet, you can say there are 200 milligrams of the active substance per one single tablet. If it's, for example, solution for injection, and the volume is 100 milligrams, you will say there are 200 milligrams of the active substance per 100 milliliters of the solution for injection. So it depends on what is in the SMPC. If you have a concrete example or questions related to how to submit the data, please have a look at chapter 3.2 guidance, which to my knowledge explains how this should be registered. If you are a sponsor user, you can have a look at the guidance for sponsors, but in any case, you can always contact us through the service desk and my colleagues will be able to assist you. Feel free to attach either a screenshot of the SMPC or attach the SMPC, so we can give you a concrete response to your request or question.
Thank you. Also accepting this one. Next, the issue is not which department forwards the relevant information, but that the agency communicates its decision later than 15 days after marketing authorization approval, resulting in the submission timeline being overdue.
Now I understand. Thank you for clarifying. The thing is, you do not know when the approval date is until you receive the communication from the NCA. So even though for example, your marketing authorization was approved on the 1st of February, but you will not receive the letter from the NCA until, let's say, the 20th of February, then the 30 or 15 calendar day timeline starts for you when you receive the letter. So on the 20th of February, even though the approval date is already on the 1st of February. I hope this kind of clarifies. If not, please submit another question and I'll try to be more concrete.
Thank you. Next, the package description information will be available in the downloaded Excel sheet.
I presume that this downloaded Excel sheet is a result of an advanced query. If yes, the package description is not available as one of the fields that you can select to be included in this extracted Excel sheet. This is something that we would like to introduce as part of future improvements of the user interface. However, you can already use the XEVMPD bulk export tool, which will provide you with all the data and all the data fields of the products that are owned in the XEVMPD by your headquarter organization, and this will include the package description field as well. So if you go to the Eudravigilance restricted area, in EV services or just under EV services, you will see bulk export and bulk update tool. And if you go to the user support, there's a bulk export user manual, which you can also use, which will tell you how to use the bulk export tool. And then you will be able to download an Excel file or an XML file with all the information about the product, including the package description. Thanks.
Thank you. I guess this next one was the same, right? Yeah. Welcome. Okay. Would you may be updating Chapter 3.2 guidance with a recommendation to submit PTs in addition to LLTs? Then MAHs can consider to submit them.
The update will be done in the upcoming weeks. Unfortunately, and my apologies for that, we just did not manage to get all the updated documentation out because we were all focusing on the release of the user interface. So the update is coming. As I mentioned, it should be done in the next couple of weeks, and you will receive an email from the service desk informing you that the new version of the guidance was published.
Thank you. While mapping the indications from the SMPC, there are scenarios where duplicate PTs are identified for different indications. Shall we only code with single PT, or we need to code the terms with identical PTs?
You will not be able to submit the same PT term in the same product entry multiple times. So you would only have to do one PT term, not multiple. One PT term per product, not the same PT terms multiple times within one product.
Thank you. Status valid pending national phase. Could something similar be implemented for the EOP when the RMS authorization is not granted yet? Sometimes urgent variations need to be submitted, for example, PSUSA. The RMS national phase can take up to more months.
If you want, Veronica, I can take this question. So, indeed, colleague, this status is referring to the any marketing authorization that is granted under either MRP, so mutually recognized procedure, or DCP, decentralized procedure. So, most of the time, it happens indeed that you have the reference member states that has just authorized the application, so the new marketing authorization. But indeed, the concerned member state, it takes quite a while to finalize the approval. So in this case, you can use this status in XEVMPD, and then it's also propagated to PMS from via Delta to start submitting your variations exactly for this need. Thank you.
Thank you. So this question was already asked earlier, but I think it's still worth to recap, Veronica. So will there be a training on how to use the new XEVMPD user interface?
No, they will not. At least it's not planned right now because we are focusing on updating the user interface with all the new user interface with all the functionalities for EMA users. I would recommend you to review the new user guide for XEVMPD web, so for the new user interface, which has all the screenshots and all the practical examples of how the user interface works. As you may have noticed, it also is very similar to the current user interface, so EVWeb. There were some minor differences. However, it is much more intuitive and works in a very similar way to EVWeb. So if you know how to work with EVWeb, I have no doubt that you will be able to work with XEVMPD web. Also, we will be releasing updated step-by-step guides, which you might find helpful. Again, this is something that is planned to happen in the upcoming months. But training-wise, it is not something that we are planning for at the moment.
Thank you. CVMPD, status valid pending national phase. Could a similar status be implemented for variation procedures?
If there is a need, this might be considered. However, the need to have the valid pending national phase came from submission requirements from PMS, I believe, and obviously EAF, etc. So if there is a need to have this, we could definitely explore this option. However, we need to have a good business case to introduce a new MA value in the existing XEVMPD.
Okay, thank you. As we enter, a DMP consists of two separate products. First contains an API, second an adjuvant, as two pharmaceutical products in one message or as one administrable pharmaceutical form, in spite of the DMP, is available in two different pharmaceutical forms.
I'm sorry, I have to read this again. Just a second.
Yeah.
I believe that API is the active ingredient, right? So the subject of the clinical trial receives two pharmaceutical products, one that has the active ingredient, the other one has an adjuvant. And then as two pharmaceutical products, well, if they receive it, if it's a combination product and they receive these at the same time, then there should be one development medicinal product with two pharmaceutical forms. When you mention in one message or One message, I presume you mean XEVPRM. So XEVPRM can contain up to 100 product entities in XEVPRM. And each of those entities, so each development product can contain multiple pharmaceutical products. So I think that in your case, you're referring to a combination medicinal product, so one DMP, where you would submit 2 pharmaceutical products, each containing the respective composition, so the active substance and the adjuvant. But it would be better if you could maybe provide me with the investigator's brochure through a service desk ticket, and again we can have a look at the information in the investigator's brochure and provide you concrete answer for that particular scenario. Thank you.
Right. Thank you. We have always submitted the SMPC as an attachment for the XEVMPD for one of our products. However, the current variation resulted in a change in PIL and not the SMPC itself. Should I submit with or without PIL as attachment?
So you can, if the variation only led to a pill, then you can add the pill to the SMPC, or you can choose to remove the SMPC and include or reference only the latest pill to your product entry. The reason why we need this particular information is that the validation team has a document that it can use as a reference source for the validation of the product information in the XEVMPD. So personally, I would leave the SMPC there and add the pill as well, because that provides more information and kind of justifies whatever change you have made to your product entry. But it is up to you if you want to either leave only the SMPC and add the pill, or if you want to remove the SMPC and just leave the pill. Thanks.
Okay, thank you. Next, status valid pending national phase. Can only be used if the authorization has already been granted by the RMS. Could a similar status be implemented for the period between end of procedure and granting of the marketing authorization by the RMS?
I don't know, Vera, if you want me to take it, but just maybe to clarify, colleagues, we in PMS, the PMS team has requested the XEVMPD team to extend the values from the RMS list to include also this valid pending national phase marketing authorization status only for those MRP and DCP products for which there is an RMS state that has granted indeed the marketing authorization as new, but to let you keep submitting your variation while you're still waiting the concerned member state to finalize their approval and the recognition of the new marketing authorization. Then I don't know, Veronica, if you want to complement my answer, but that's the only scope and the reason why we have asked and implemented this new term in XEVMPD and so reflected in PMS, because PMS is linked to the PLM portal, and as you know, we are digitalizing the whole system, and in the future the EAF is actually already partially connected to the PMS PUI portal, but there is a need to being able to retrieve the products once these are authorized, in this case from the RMS in the context of DCP MRP procedures, because you have to submit already variation probably, and you cannot wait the whole concerned member state that they have granted the approval.
Thank you. In which document can we find your explanation regarding the delay between approval date and NCA communication received and the real date we have to take for compliance purposes?
I suggest you check the Article 57 FAQ document, I believe, which is published on the guidance documents webpage. Have a look in that document. I think that information might be included there.
Okay, thank you. There was a question about volumes, but sometimes it is written in SMPC, reconstitution with water in a glass. How can we structure that?
So you are providing the active substance or the composition information for the administrable, not for the authorized pharmaceutical product. So if the product must be reconstituted, then you should provide the active substance strength as per after the reconstitution. So if, for example, you have to reconstitute the active substance with water, then you can try and reflect this, for example, saying it must be, you provide the volume for whatever needs to be the volume of the water in which it is reconstituted. Again, it's better if you provide us with the exact SMPC through the service desk. We can have a look at it and provide the correct answer.
Thank you. For a development medicinal product, I was wondering whether substance information, for example, excipients, is publicly accessible. Typically, there is little incentive for companies to make the active substance or excipient composition easily identifiable to third parties.
So in XEVMPD, the only people that will see the development medicinal product information are people from the company that submitted that product information in the XEVMPD, and obviously the EMA. When the product information is then visible in CTIS, I believe that the visibility rules there might be slightly different, so I would suggest that you check with CTIS colleagues. However, in XEVMPD, anything that is entered for a development medicinal product is considered confidential, and so only visible, as I mentioned, to the users from the company that own the product information, and by that mean the product record in XEVMPD, and to the EMA. Also, with regards to excipients, the reference of excipients in the DMP is optional. So you do not need to provide excipients information for development medicinal product, only the active substance and the concentration of the active substance.
Okay, thank you. Next, we are unable to access the link of a new XEVMPD user interface that is available in the XEVMPD database and can only access from the link received in the email from service desk. So can you confirm link availability for the users?
So I presume you're referring to the links that are published in the EV services section of the Eudrovigilance restricted area. To my knowledge, the links work. There should be two links. One is for the new user interface, one is for the old, and both of the links work. So if this is not the case, can you please log a ticket, and can you also include a screenshot of what happens when you click on that available link, any kind of error message that you get? That would be really helpful. Thank you. But both of the links should work.
Thank you. How should we enter a combination of development medicinal products that consists of two separate products with different API? In case of two development medicinal product submissions in one message, what's the difference between submission of a combinational development medicinal product and two different development medicinal products entered in one message?
So an XEVPRM, so extended Eudrovigilance medicinal product report message, is like an envelope. And in that envelope, you can submit a letter. And as part of the letter, you can provide 100, up to 100 entities. And as I mentioned before, the DMP entity can reference multiple pharmaceutical products. So it's not strictly about how many pharmaceutical products or how many development medicinal products I can submit per XEVPRM. You can submit one DMP with multiple pharmaceutical products per XEVPRM. You can also submit up to 100 development medicinal product with one or multiple pharmaceutical products per XEVPRM. Like the way you submit the product information in the XEVPRM is really not restricting you to submitting. You are not restricted to submit one or multiple medicinal products through the same XEVPRM. In terms of how you report the product information is XEVMPD, it depends on what the subject of the clinical trial receives. So if the subject received, if you have active substance which is studied, for example, in two different strengths, it's the same active substance in the same pharmaceutical product, and it's studied, as 100 milligrams of the active substance, and it's studied also as 500 milligrams of the active substance. One group of users gets the 100 milligram tablet, so you will have to submit one development medicinal product referencing that one pharmaceutical form, which will be the tablet, with the composition of 100 milligrams of the active substance. And if another group received the same product, however, with a higher concentration of the active ingredient, so for example, the 500 milligrams, then you will submit a second development medicinal product, also with one pharmaceutical medicinal product, where the volume of the active ingredient will be specified as 500 milligrams. So every time the same active substance is studied in a different pharmaceutical form or different concentration, you would have to submit another development product in the XEVMPD. I recommend that you have a look at the principles described in the guidance documents for sponsors. I think it's Annex 1, no, Process Map 2, which will tell you what are the principles for the submissions. So if this changes, then you should submit this development medicinal product. If this changes, then should it be the same pharmaceutical product or should it be a different pharmaceutical product? So you need to differentiate between combination products, so two pharmaceutical products given to the subject at the same time, or then completely different products.
Thank you. So before we proceed with the next questions, I just wanted to flag that, as usual, I've opened the feedback survey for this session, where you can leave on Slido your feedback, just a simple rating question on how useful was this session in answering your questions on XEVMPD, and a free text box also for you to leave any additional suggestion you may have for future sessions. Thank you. So let's go ahead. Here is the SMPC for volume. Posology, 600 milligrams per day divided into 3 doses. So 1 sachet 3 times a day. Dissolve the powder in half a glass of water and drink preferably before main meals. So that's related to another question. Yes.
So if I understand correctly, 600 per day divided into 3 doses, 1 sachet. So I presume there's 3 sachets, each contains, and again, this is me presuming, 200 milligrams. So I would say that in this particular case, you enter it as 200 milligrams per sachet, per single sachet.
Mm-hmm. Yeah, I guess. Yeah. Yeah. Seems from the sentence. Okay. Do you need further clarifications, or should I move on?
I think you can move on. Thank you.
Okay. Okay. Mm-hmm. The medicinal product EV codes are available in EV Web, but why is it not reflecting in the PMS user interface?
Sorry, I was muted. So if you have it in EV-Web, it should be definitely in PMS. So I cannot tell you why. I will need an ID or at least a PMS and a PRD code to check what's happening in PMS. It might be that you don't see the package, the corresponding package in PMS, so that's because of we are gradually addressing all the products impacted by this transfer. Or it might be because there is a problem with the validation version in XEVMPD. We notice sometimes, it shouldn't be the case always, but we notice that sometimes when we have the version in XEVMPD still pending, somehow the delta from XEVMPD to PMS don't work. So for us to wake them up, let's say, the best solution, the quick one, is to ask the XEVMPD team to validate and see if it's propagated. But I will need to have a bit more context. Maybe you can add more information in the comment section. Thank you.
Thank you. Okay, here we have an access issue to the test environment link. They say, a few people say an error occurred, and when they try to refresh, it says that the user is not assigned to any organization. I would guess probably the recommendation here would be to open a ticket to raise an incident on the service desk, Veronica?
Exactly, and also clarify, well, first of all, I would check if how your organization is registered in EudraVigilance. Presuming that your organization is correctly registered in EudraVigilance for medicinal product reporting, I would also check if your organization has a valid current QPPV assigned. Because if your organization in IAM, so in the EMA account management, does not have a QPPV assigned, then no users have access to XEVMPD through the user interface. So that would be my second step. And if you do have a QPPV, you are also a registered user and you should have access to XComp and you do not, then definitely please open a ticket. Please provide us with a screenshot of the error message you receive. Also, please provide us with the organization's name, organization, headquarter organization ID, or the ID of the affiliate under which you're trying to log on, and obviously confirm that you are a registered user, and we will investigate. Thank you.
Thank you. If I submit an update via XEVMPD, can I see it next day in PMS, or can I see only the versions validated by EMA?
Okay, I can take this, Veronica. So when you submit an update in XEVMPD, you should be able to see this update in PMS reflected almost live. Now, there are a few factors that we need to consider in this live wording. It depends by the queue. So if you have a lot of users in XEVMPD submitting many messages at the same time, the queue might get longer, so the time to load the data from XEVMPD to PMS API might take longer. I'm talking about PMS API. It might also be that also, as I mentioned before, it should happen live, but if you have a lot of traffic in XEVMPD, that might trigger some delays. In any case, if you don't see by 24 hours this change being reflected in PMS, we need to have a look on what happened. I can tell you from some tickets that I see and I review almost daily, we notice that indeed, if the user submits a change, sometimes the change is not propagated correctly as expected by the delta from XEVMPD to PMS. And we notice that if I ask the XEVMPD team to validate the version, so moving from pending to valid, somehow is propagated. It's something linked to the delta. It's not the XEVMPD fault or PMS fault. It's just the mechanism to load the data. But again, if you have or you are experiencing any of these issues, because I see tickets today, you can always open it and we will have a look in the back end. Thank you.
Thank you. In case of Luxembourg, which document should be referred for authorization or renewal date? Can we use Belgian renewal date for from SMPC?
I believe that it should be the copy of the marketing authorization in addition to the Belgium SMPC.
Okay.
Yeah.
Thank you. So there's a clarification on the access issues. We are able to open the XEVMPD production environment link, but not XEVMPD test link.
Okay, this indeed doesn't seem right. So please open a ticket and we will investigate. Thanks.
Yeah, also because I saw quite a few upvotes, so I guess that's something a few users are experiencing. Next, if information about a new manufacturer was added only to the PL and not to the SMPC, should we update the XEVMPD entity and attach the PL? Or is this information not relevant for XEVMPD?
So we do not keep manufacturers' information in the XEVMPD. So to us, this information is irrelevant.
Okay.
But Vero, maybe you want to complement from PMS point of view?
Okay, I thought I was muted. Okay. So let me put a bit on order here. In PMS, all we are asking for is to submit the new the manufacturer's data. So if definitely you have new information, then you will have to enter access in PMS, either API or POI, and you can submit the information. Now, I know that some manufacturers' data are in SMPC, in Annex, or in the package leaflet. So it doesn't matter actually, as long as you have authorized data and up-to-date data, this should be entered into PMS accordingly. Thank you.
Okay. Thank you. Would the EMA have any concern if a marketing authorization only uploads the SMPC and not the PIL?
No, because you as MAH can submit either the SMPC or the PIL, providing that all the information that we need to check in order to verify that the information provided for that medicinal product in the XEVMPD is available in that document that you reference. So either in the SMPC or the PIL. As long as all the information is there, there is no concern. If there is any kind of missing information, then we would get back to you.
Okay. Thank you. It is very time-consuming to constantly access XEVMPD in order to monitor the status of submitted XEVPRMs, as we are a PV service provider. Are there any plans to implement automatic notifications for users?
In this case, I presume that you are service provider that uses WebTrader, and therefore you use the WebTrader inbox and outbox to monitor your submissions. To be perfectly honest, no, there are no any plans to implement any kind of automatic notifications, which would maybe be, an email or something that would tell you now have an acknowledgement in your WebTrader inbox. This is not really something that we have considered for the future.
Okay, thank you. Our time is almost over, so I'll just take a last question. Do we need updating the initial entry with a second indication in case we'll use the same dosage form and strength of a development medicinal product in a CT, but for another or additional indication?
So the reference of indications in a DMP entry is optional. So again, you do not need to provide any information related to the MedDRA code in the development medicinal product. If you do, and then the indication also changes or there's additional indication, then you can update the existing entry and add the second indication to the same development product entry. You do not need to enter a second development medicinal product to basically reference a different indication.
Okay, thank you. So unfortunately, our time is over for today. Thank you all very much for participating. And I remind you that actually for the next Q&A clinic for XEVMPD that is taking place on the 10th of March, shortly, maximum a couple of days, you will see already on the event page the Slido link for the for the session. So in case your question was not answered today due to time limit and it's not an urgent question, for those you can go to service desk. In this other case, you can already copy that question in the new Slido link for the March session, and we'll make sure to answer then. And yes, for the rest, I wish you all a very good rest of the day, and thank you, Veronica, for replying to the questions on XEVMPD, and Veronica to reply to the questions on a PMS angle.
Pleasure.
So thank you both very much, and have a nice day. Bye-bye.